Alright, so we're going to look at another type of drugs. It's kind of like a classification of drugs. So they are used in treatment of heart failure. Okay, so this classification of drugs, we call them the positive inotropic agents. So I'm trying to look at reasons why they are called positive inotropic agents. Then also I'm now trying to look at how are they being able to be used in treating heart failure. That's basically their mechanism of action. How do they work? Because if you are putting drugs in the same group, of course they have the same way of acting. So positive inotropic agents, you know that they are drugs that increase the force of cardiac contraction. So your heart is failing, it's beating small, so you want to give drugs that will actually make it beat faster. So they are mainly used in acute decompensated heart failure or advanced cases where symptoms persist despite standard therapy. So their use is generally limited to short-term support because of risks such as arrhythmias, increased mortality. That's if you use long-term. So what are the examples? We have drugs like beta adrenergic agonists. You can actually pause to look at their mechanism of action, their clinical use. Okay, you can just focus on that now. Okay, like dobutamine. This is dobutamine. We have other ones like the phosphodiesterase 3 inhibitors, like the milrinone. Then we have other drugs like calcium sensitizers. So calcium sensitizers, drugs like the level C mendan. Okay. Then available outside the US. Then we have cardiac glycosides like Digoxin. So this one, your heart is failing, to basically come in to make your heart beat more. So that's it. So clinical concentration is short-term use. So you often use them for just a short while. Okay, and that's the rest. But if you want to use anyone for long term, the only drug that is advisable is what? Digoxin. Alright, so that's it for this class. We'll come back later and talk about their individual pharmacologies.